women. If we got injured, I'd have to go into a public hospital, and I'd end up losing all of my few assets I have. I want to hear more from you than your statement that on the day you're elected, you're going to end Obamacare. I want to know what you're going to do in order to make health care affordable.
That is the best question, because that's really what the problem is in healthcare, is cost. And when I was growing up here in Waterloo, when my parents would take us to the doctor, do you know what a doctor visit cost us? It was $5.
But that's
A doctor visit was $5 when I was growing up. That's before the federal government intervened in healthcare. It was the mid-1960s when the federal government intervened in healthcare, and that's when you saw healthcare costs jack through the roof. Prior to that, most people could afford to go to the doctor and pay for health care on their own. And the other part of that is that doctors and nurses and hospitals had a certain amount of charitable care that they would offer. We will always have people in this country, through hardship, through no fault of their own, who won't be able to afford health care. That's just the way it is. But usually, what we've had are charitable organizations or hospitals who have enough left over so that they can pick up the cost for the indigent who can't afford it. But what we have to do is we have to be a profitable nation that's growing so that we can pay for those people who can't afford it through no fault of their own. Once Obamacare is gone, this is what we have to do. Maybe in every state in the country, all 50 states, the government has given a monopoly to insurance companies in every single state. I think we should do away with that monopoly for insurance companies.